Hello, and welcome to Alcohol and Drug Awareness. Here at the Office of Health Promotion, we believe students need to be well in order to do well during their time at SHSU. Our stance is not necessarily just abstinence from alcohol, but also for safe and responsible alcohol consumption for those who do choose to drink. Ultimately, we envision a safe and healthy SHSU community that is free of the negative and tragic outcomes attributable to alcohol and drug use. Imagine or think back to your first year of college. This is your first time living away from your parents and family. While you may be homesick, there is also an underlying newfound feeling of freedom where you can do anything that you want. Now imagine going to the first party of the year. You feel a little nervous, so your friend tells you to have a drink because that will ease your nerves and help you socialize. You soon find that your friend is right and you start to have a good time. A group of people invite you to play a drinking game with cards and it seems like fun, so you play with them. One game later, you're starting to feel a little dizzy. You continue to play more games and find that you really like playing beer pong. The room is warm and everything seems funnier. You notice that you don't feel so shy anymore. You wake up the next day and don't remember anything and have a horrible headache. So what happened? Although having a drink of alcohol every now and then isn't typically dangerous or risky, it is important to recognize the risks and dangers that come with consuming excessive amounts of alcohol. As we break down how and why to drink responsibly, we will talk about what alcohol is, quickly review the effects of alcohol, what standard drinks are, the legal risks and policies, and discuss safety and prevention. We will also discuss different types of drugs popular among young adults, as well as the risks and health effects associated with drug use and abuse. Lastly, we will discuss how to be safer and what that entails. So with that being said, let's get started. What is alcohol? Alcohol is one of the most commonly used and abused drugs in the world. Alcoholic drinks are beverages that contain ethanol, and depending on their amount and volume percentage, some drinks are stronger than others. Here are some different types of alcoholic beverages. Alcohol is typically fermented or distilled. Fermented beverages such as beer, cider, and wine are made from natural sugars from plants. Distilled beverages such as rum, vodka, tequila, and whiskey are further purified to concentrate the ethanol content. Ever heard the phrase liquor before beer, you're in the clear? It turns out that's not actually true. It is not about what you drink first, but about how much you drink. So what exactly is getting drunk? Well, if you're asking in a literal way, it is drinking excessive amount of alcoholic beverages. Alcohol disrupts your central nervous system by slowing it down, which affects your breathing rate, heart rate, and brain function. Artificial sweeteners and carbonations speed up the process of getting drunk, so care should be taken when mixing alcohol with soda or juice. So why do people drink? Some people may enjoy the taste of alcohol or the way it makes them feel. It may help them unwind and be more sociable with others. Others may drink to cope with stress, depression, and other mental health problems, which is not healthy. Every country has its own laws regarding alcohol use, particularly when it comes to the operation of motor vehicles. Remember, if you are under the age of 21, you are not allowed to consume, purchase, or possess any alcohol. So what about those of us who are 21 and over? The U.S. Department of Health and Human Services and the U.S. Department of Agriculture suggest consumption of no more than 1 drink a day for women and up to 2 drinks a day for men. It is also advised that anyone who is pregnant or has health problems that could be made worse by drinking should not drink. These recommendations are meant to encourage drinking only in moderation and help avoid binge drinking. Binge drinking is the consumption of an excessive amount of alcohol in a short period of time. So what is excessive? Well, a good way to tell if drinking is excessive is by using the 5-4-2 rule. If you are male, binge drinking is when you have had more than 5 standard drinks in 2 hours. If you are female, you are binge drinking if you drink more than 4 standard drinks in a 2-hour time span. 5 drinks for males or 4 drinks for females within 2 hours equals binge drinking. 5-4-2. To follow the 5-4-2 rule, you need to know what a standard drink is. Many people are surprised to learn what actually counts as one drink. The amount of liquid in your cup, can, or bottle does not necessarily match up to how many standard drinks of alcohol you're having. Even though they come in different sizes, each of the following are examples of one standard drink. One standard beer is defined as 12 fluid ounces. A standard drink of malt liquor is 8 ounces. However, many liquor beverages are sold in 40-ounce bottles or cans. This makes one of those cans or bottles 5 standard drinks. Drinks like Smirnoff and Mike's Hard Lemonade are considered flavored malt beverages, but because of their low alcohol content, a standard drink is about 11.5 ounces. A standard glass of wine is 5 ounces. A standard drink of distilled spirits or liquor is 1.5 ounces. Mixed drinks like a 3-ounce margarita is actually about 1.7 standard drinks because it contains nearly 2 standard drinks of liquor. Although it has the same alcohol content as wine, an entire 23.5-ounce can of Four Loko is equal to about 4.6 standard drinks. For more information, visit this website.
Another factor that affects how a person gets drunk is their blood alcohol content, or BAC. BAC is the amount of alcohol in your bloodstream. Factors that determine your BAC are the number of standard drinks consumed, amount of time in which drinks are consumed, body weight, and assigned sex. Each level of BAC has different effects on the body. The higher the BAC, the more serious these effects are. At 0.00 to 0.03%, BAC is known as the fun zone because there's typically no major impairment. However, people may have fewer inhibitions, making it easier to communicate and socialize with others. A 0.03 to 0.06% BAC results in mild euphoria and impairment, but is still within the legal driving limit for those who are at least 21. With a BAC between 0.06 to 0.10%, a person may feel buzzed, euphoric, and may begin to experience increased vision and motor skill impairment. Once your BAC is over 0.08%, you are past the legal limit to drive. However, due to the effects of alcohol, it can be dangerous to drive at any BAC level higher than 0.00. At 0.10 to 0.20%, a person may begin to feel drunk, have emotional mood swings, slurred speech, nausea, slower reaction time, and loss of motor control. Once you have reached a BAC of 0.3 to 0.4%, you may become unconscious, unarousable, lose bladder function, or risk death. At a BAC above 0.4%, it is highly likely that a person will be unconscious, have impaired breathing, and be at a very high risk of coma or death. In Texas, the legal limit to drive for those who are 21 and over is 0.08 BAC. For anyone under 21 years old, the legal limit is 0.00. To minimize the risk that our alcohol use presents, it is important to make a plan to ensure a fun and safe outcome. For example, make a plan to get home before you begin to drink. Make sure you have a safe ride, such as a taxi, Uber, or a ride from a sober friend. Never drive after drinking, even if you think you're okay. It is not worth the risk. The penalties for drinking and driving could cost you up to $17,000 in fines and fees, time in jail, and you could lose your license. Recent studies have shown that young adults between ages 18 to 24 in Texas make up a significant amount of people involved in a car crash due to driving under influence of alcohol. More alcohol-involved crashes are reported between 2 a.m. and 2:59 a.m. than any other hour of the day. In addition, most of these crashes occur on Saturdays. It is very important to keep these factors in mind before planning a night out. This map shows the most recent data on the number of alcohol-involved crashes in Texas County per year. Notice that Harris County has the highest number of alcohol-involved crashes in the state. Additionally, Bexar County and Dallas County, which include San Antonio and Dallas, also have a high amount of alcohol-involved crashes. We realize that you may not always be in Huntsville, so be aware when you're at home or on the road visiting friends and family. Unfortunately, many Texans are killed in alcohol-related crashes every year. Please remember that making responsible choices about engaging in alcohol use not only affect you, but others around you. Another way to ensure the safety of yourself and others is by being a good bystander and friend. Knowing and recognizing the signs of alcohol poisoning could save a life. A good way of remembering the signs of alcohol poisoning is by remembering the acronym MUST HELP: mental confusion, unresponsive, seizures, stupor, throwing up, hypothermia, or low body temperature, erratic or slow breathing, loss of consciousness, and pale or bluish skin color. Alcohol poisoning is serious, and quick action must be taken if someone is experiencing these symptoms. The first thing is to call 911 and stay on the phone with dispatch until they tell you to hang up. While you're waiting for EMS to arrive, try to keep the person awake and sitting up if they are still conscious. If they can drink water on their own, give them water. It is important that we emphasize that you should only give them water if they can drink it on their own. Otherwise, they could choke. Since body temperature lowers with alcohol consumption, make sure to keep the person warm. Next, check if they are breathing properly. Stay with them and monitor their symptoms. To keep them safe from choking on their own vomit, Lay them on their side into recovery position if they have fallen asleep or become unconscious. Here is what recovery position looks like. Lay the person on their back and place their right hand next to their head. Place the left hand on the right cheek before beginning to roll them on their side. Hold their left shoulder and left leg and pull the body towards you. Roll them onto their side. Notice that the hand under their cheek supports their head and prevents them from choking if they vomit. The position of their knee aids in preventing them from rolling onto their stomach, which could be deadly if they vomit. Now that you know what you should do if someone is experiencing these symptoms, let's go over the things you should not do. Don't leave a person to sleep off their drunkenness. This is very dangerous as your BAC levels can continue to rise, making it extremely risky to leave a person unattended to sleep. Although you may have heard differently, don't give them coffee to sober them up. Coffee will further dehydrate them. The only way to sober up is with time. Do not force the person to throw up, as they could choke. Don't put them under a cold shower because this will further lower their body temperature. Keep in mind that these tips also serve to help anyone who is heavily intoxicated but not necessarily showing signs of alcohol poisoning. Lastly, don't let them drink any more alcohol. If you are unsure if they'll be okay, call 911. No matter the circumstances, your health and the health of others should always be put first. Sam Houston State University has a Good Sam policy that gives amnesty to any student acting in good faith for another student in need of help, as long as they cooperate completely with medical personnel and police. Now that we've covered what alcohol is, how it works, and the potential dangers, let's go over the legal risk and penalties of irresponsible and illicit use. Alcohol-related offenses can lead to consequences such as hefty fine, license suspension, and even jail time. In Texas, if you are pulled over for being intoxicated while driving, what you are charged with could differ depending on your age. An individual under the age of 21 will be charged with driving under the influence, or a DUI, if they have a BAC over .00. An individual over the age of 21 will be charged with driving while intoxicated, or a DWI, if they have a BAC of over .08. Keep in mind that it is illegal for a minor to drive with any amount of alcohol in their system. DUI and DWI penalties in Texas can include fees ranging from $9,000 to $24,000, community service, probation, and jail or prison time. SHSU also has consequences for irresponsible illegal drinking, such as mandatory counseling sessions, cancellation of residence hall or apartment contracts, withholding of official transcripts or degree, or loss of ineligibility for student grants or loans. For those who choose not to drink, it's important to know the dangers and risks associated with alcohol in case any of our friends and those around you drink. We'd like to point out that it may feel like everyone in college drinks. This is not necessarily true. In a recent survey of SHSU students, almost all believe that their peers consumed alcohol at least once within the past month. In reality, close to half of those surveyed did not consume any alcohol at all in the past month. This tells us that students perceive that a higher number of their peers consume alcohol regularly, even though it's not true. So next time you feel pressure to drink because everyone does, just remember that that's not actually the case. Now that we've discussed the risks and dangers of irresponsible or illicit consumption of alcohol, it is important to discuss the different types of drugs and the risks they present. Unfortunately, drugs also play a part in the newfound freedom that students experience. Let us begin with the most commonly used illicit drug in the United States, marijuana.
What is marijuana? Marijuana is the dried leaves, flowers, stems, and seeds from the cannabis sativa or cannabis indica plant that contains mind-altering and chemical compounds. It's typically smoked, brewed as tea, or mixed with food. Marijuana is used for both medicinal and recreational purposes. However, neither medicinal nor recreational marijuana is legal in Texas. The chemical that produces the high people experience is called THC. While everyone's experience is different, some commonly experienced effects of marijuana include feelings of joy and relaxation, altered sensations, and increase in appetite. However, marijuana can also cause loss of coordination, a faulty perception of time, trouble with thinking and problem solving, dizziness, problems with short-term memory while under the influence, and in extreme cases, anxiety, panic, or paranoia. The risks for an automobile accident increases when under the influence of any mind-altering substance. Because marijuana impairs perceptions, motor movements, and coordination, pairing marijuana use with driving is dangerous, irresponsible, and illegal. Marijuana is not the only drug commonly abused by college-aged individuals. Others include legal drugs, such as prescription over-the-counter drugs, and illicit drugs, such as synthetic marijuana, cocaine, and MDMA. Let's cover prescription drugs first. It's important to remember that prescription drugs are to be taken as prescribed and only by the person that they are prescribed to. Prescription medication should not be shared, and if any remains after treatment, it should be properly disposed of so that it doesn't fall into the hands of others. Commonly abused opioid prescription drugs are fentanyl, Vicodin, OxyContin, and Percocet. These drugs are commonly prescribed for pain relief, but can carry a high risk for tolerance and dependence. Tolerance is a person's diminished response to a drug that is a result of a repeated use. Dependence is caused by changes in the body from constant exposure to a drug. This makes the body feel as if it needs the drug in order to function. Another type of prescription drug that is commonly abused are depressant medications, which are prescribed to treat anxiety and sleep disorders. Like opioids, depressant drugs such as Valium and Xanax also carry a risk for tolerance and dependence. A third type of abused prescription drug is stimulants such as Ritalin, Concerta, and Adderall. These medications are prescribed to treat attention deficit hyperactivity disorder, or ADHD, and narcolepsy. These drugs are abused to increase focus for long periods of time. These all carry negative effects and health risks such as chest pain, seizures, irregular heart rate, difficulty breathing, anxiety, paranoia, irritability, stomach pain, insomnia, and hypertension. They also carry the risk of overdose, which can lead to death. Like prescription drugs, it's also important to take over-the-counter medications as directed and only when needed. These medications include cough syrup, pain relievers, and motion sickness pills. Cough syrup has dextromethorphan, which is a cough suppressant. It is typically abused by mixing it with soda and alcohol, which is especially dangerous. Because it's inexpensive and easy to access, teenagers and young adults are most likely to abuse cough syrup. Motion sickness pills contain dimenhydrinate, which is used to treat nausea and dizziness. However, when used in excess, it could also produce a high and hallucinations. Lastly, pain relievers such as Motrin, Tylenol, or ibuprofen, and other similar drugs are used to treat colds, flu, and pain symptoms. Pain relievers should only be taken as suggested by the label on the package to avoid some of the severe effects and risks. Pain relievers should not be taken with alcohol. Some of the effects and risks of abusing over-the-counter drugs include tolerance and dependence, impaired motor functioning, nausea, vomiting, increased heart rate and blood pressure, acid buildup, liver damage, convulsions, stomach pain, seizures, and, in extreme cases, coma or death. In addition to legal drugs, there are also illicit or illegal drugs that may be commonly abused by college students. These drugs include synthetic marijuana, cocaine, and MDMA. Synthetic marijuana, also called spice, is plant material coated with synthetic cannabinoids or other substances that is typically smoked. While it's called synthetic marijuana, it's not marijuana because there is no certainty as to what specific chemicals are in synthetic marijuana. Consumption is especially risky and dangerous. Cocaine is a stimulant drug that is typically snorted, injected, or smoked. Crack cocaine is the crystal form of cocaine that is less pure and, as a result, less expensive than powdered cocaine. MDMA is both a stimulant and hallucinogenic drug. MDMA is also called ecstasy or Molly. It's known as a party drug and is typically associated with raves and music festivals. The health effects and risks of using these drugs vary by the drug, but mostly include tolerance, dependence, confusion, paranoia, irritability, and irregular heartbeat. Prolonged use and abuse of these drugs can put a person at risk for a decline in mental health, overdosing, and death.
While we realize that every student will not choose to abstain completely from drugs or alcohol, we hope that the information provided will help in making educated and safe decisions concerning these topics. When making the choice to use alcohol or illegal drugs, consider the acronym Be Safer. S is for safe. Use alcohol, over-the-counter drugs, and prescription drugs in a safe manner and make a plan to get a safe ride home before you drink. A is for be assertive. Be bold and confident to resist peer pressure and be the voice of reason. F for be functional. If you choose to drink, have fun, but remain functional and in control of yourself. E for be educated. Know how drugs and alcohol can affect your health, your well-being, your job, education, and your life. R for be responsible. Drink responsibly and use prescribed and over-the-counter medication responsibly to avoid the negative outcomes. We hope this information about alcohol and drugs has been helpful. We encourage you to enjoy your time here at SAM by having fun, making healthy decisions, and succeeding in all of your academic endeavors. If you have any questions, please contact our office by emailing us at healthpromotion@shsu.edu. You can also follow us on Instagram and Twitter at @SHSU_OHP or like us on Facebook at SHSU Health Promotion.